Let's compare two countries, the United States and Uganda. Both offer their citizens a variety of medical centers and clinics. Here's one in Uganda. One major difference is in the way healthcare centers in each country collect patient information. While the United States has an electronic-based patient data collection system, the majority of hospitals in Uganda employ a paper-based system. The electronic-based system in the United States allows hospitals to keep track of many patients and efficiently manage their information. In Uganda, the paper-based data collection system, which is difficult to manage, prevents efficient aggregation of patient data for subsequent care and research, and creates a logistical hassle for hospital administrators. The electronic system in the United States allows hospitals to easily access and add to patient data. If a patient were to visit a different medical center, this information could easily be transferred. In Uganda, many citizens rely on rural clinics, which typically lack many of the resources needed to effectively treat patients. These patients end up having to travel across the country to visit other hospitals. The paper-based system in Uganda hinders the transfer of medical records. Each time a patient arrives at a different medical center, a new file is created. There is a need to introduce developing world healthcare systems to electronic-based record keeping. This would allow for increasingly personalized care, saving lives like these. Ease of patient data transfer between healthcare centers, whether national, private, or rural, and the aggregation of clinical information for research purposes. We are proud to introduce Unahd, the Uganda National ID Associated Healthcare Database. Unahd is a central database consisting of two interfaces that link patient information to their national ID. In Uganda, a national ID is issued to every citizen. With Unahd, patients provide their national ID upon arrival at a healthcare center. Patients then receive a wristband marker that is scannable by hospital providers and links them to their national ID in the database. Provider Interface 1, the administrative interface, facilitates procedure scheduling. This interface improves hospital efficiency and allows patients to be provided with approximate waiting times. When patients receive treatment, their markers are scanned, which opens Provider Interface 2, the treatment interface, and allows healthcare providers to access patient history and enter notes. Unahd will enable healthcare centers to store and access past and present patient information. This allows healthcare providers to make better patient-personalized decisions to improve care. In addition, if a patient were to transfer hospitals, their records could easily be transferred through their national ID. Unahd will also progress healthcare in the developing world through the efficient aggregation of data that can be used in research studies to illuminate trends and possible treatment options. Unahd has the potential to save lives and progress healthcare in the developing world by facilitating access to clinical information and allowing healthcare centers to work together, improving the lives of millions of Ugandan and developing world citizens. Thank you.